I'm Dr. Vardit Ravitsky, professor of bioethics at the Université de Montréal, and president of the International Association of Bioethics, and chair of the COVID-19 Impact Committee of the Trudeau Foundation.
What are bioethics and GE3LS, and how do they intersect with biomanufacturing and bioengineering?
Bioethics is a field that studies the societal implications of biomedicine with a focus on biotechnology. It looks at ethical, social, legal, policy, governance aspects of these emerging technologies. GELS, the way we call it in Canada, is the Canadian iteration of the more familiar term ELSI, which stands for Ethical, Legal, Social Implications. The history of the term is very interesting. When the Human Genome Project was launched by the National Institutes of Health, there was a recognition that the study of genomics is particularly problematic from an ethical perspective because of the history that we have with eugenics and with the abuses of eugenics in the context of human societies and the great suffering that eugenics brought. So the idea was to set up a research field that would accompany the science and would look at the possible societal implications of sequencing the human genome. And a budget was set up for this work right from the beginning. So the ELSI work, the study of the ethical, legal, social, went along with the science, which was actually the first time that ethics was given a place side by side with science and not chasing behind scientific developments. And so this spread from the US to the rest of the world, and many countries have research programs that look at the societal implications of genomics. Canada is unique in its 3 E's. So it added to the ethics also economic and environmental implications and made its GELS program broader in scope. So it includes more disciplines, more methodologies than other countries. It also implemented a very unique model in which, in order to get your research funded by Genome Canada, you must include a study of GELS, whatever the GELS are that are relevant to your field of study. And that put Canada on the international map in terms of our excellence and leadership in GELS research. What's really important in terms of biomanufacturing and bioengineering is that GELS research and GELS analysis can help us identify, analyze, and even address issues that might come up when the research is applied for manufacturing, applied in the health sector, in any other sector. So it can help us with the acceptability, the ethical and social acceptability of new technologies that are being implemented. It can help facilitate this implementation. It can help design governance that will ensure that innovation is implemented responsibly. And in some cases, it might even limit the application or limit certain applications due to GELS concerns. So anything from facilitate to limit based on the way we've identified and addressed GELS issues.
How potentially transformative or disruptive, since that's a popular term these days, are biomanufacturing and bioengineering for Canada's future economy?
I think biomanufacturing and bioengineering are both critical to Canada's future economy. You know, I heard a talk this week from a leading scholar, and he said we have lived 3 big revolutions recently. Early in the 20th century, we had the revolution in physics with Einstein, the nuclear bomb. Then came the revolution of information technology in the late 20th century. And now we're living the revolution in biology. Genomics, epigenetics, gene editing, we are really crossing boundaries that we haven't crossed before, giving us better, more efficient, more precise and cheaper tools to do things we could never do before. And I think this opens doors to many applications that we couldn't even imagine, and it is clearly tied to the future of our economy. Another element is that the world is moving forward and Canada needs to remain competitive on the international scene. If we don't support the research now and the application tomorrow, we will be left behind in this global race to improve agriculture, human health, which incidentally also has economic implications. As a bioethicist, I'm more interested in the benefits to the public, whether to individual patients, communities, or our society. Economic growth is not my mandate or my field, but everywhere as a researcher, I see the economic implications of doing good for our society.
Could you perhaps highlight some real life impacts this could have on Canadian health in the coming years and beyond?
The implications of those emerging genomics and biotechnologies for human health are enormous. We're talking a lot about precision medicine, about genomic medicine. We know that the cost of sequencing the human genome came down from billions to $1,000 and is becoming accessible. We're talking about integrating what we've learned about genomics into routine care of every patient, not just for the diagnosis of rare disease. So the implications can be anything from tailoring better drugs for cancer, for heart disease, for diabetes, for common diseases, understanding how drugs should be tailored to you as an individual based on your own genome, understanding the epigenetic risks that you carry, something that we didn't even know about before and didn't know how to diagnose. So this is like a second layer of care that we might be able to provide very soon. Your family doctor looking at the full sequence of your genome to understand better how to care for you. That is really the great hope of precision medicine and genomic medicine. We're not there yet, but we're going there very fast. So that's at the level of us as patients. Of course, for children, diagnosis and care of rare disease, even diagnosis without care has proved to be helpful. We hope to be able to come up with new treatments through gene therapy and gene editing, somatic gene editing, to help address rare diseases, some of them very severe, that do not have any other treatment at this time. And going from adults to children even further back, if we look at the prenatal context, that's where very exciting things are already happening, because the identification of cell-free fetal DNA has revolutionized prenatal testing, allowing pregnant women, families to know much more about their fetus much earlier in the pregnancy without the risk to the pregnancy that procedures like amniocentesis entail. So almost at every stage of pre-life and life, we see possible applications for human health and really a revolution in the way we care for pregnancies and patients. That is, of course, not to mention addressing public health issues through genomics technologies such as gene drive to eradicate mosquito populations in order to prevent malaria. So, you can think about the individual patient and the impact on care at that level, but you can also think about bioengineering at an environmental population level to address disease at the public health level.
You mentioned you're a bioethicist, and so I want to talk about ethics a little bit. And much like in other topics or other areas like artificial intelligence, for example, the public often has these, fears and perhaps misconceptions as well about, what this kind of progress, in a sense, could also have as sort of side effects. Could you speak a little bit about those implications, the implications of genomics advances on health in other Canadian sectors, and how can we best manage them here in Canada?
I'll start from research and go to implementation. So at the research level, some of these studies subject participants to unknown risks because we're doing something for the first time ever, a new type of intervention. So for example, somatic gene editing, we've never done this before with these tools. And so we have issues around informed consent for research participation. Without participants, we can't move ahead with understanding the technology and get to the point of implementation and benefit. But how do we inform research participants about risks when we're not sure what they are? So that's one possible impact. Once we have technologies that we can actually move to the clinic or to the public health use, we'll face issues such as safety. So sort of post-implementation studies. How do we assess long-term and on a populational level the safety of what we're offering? We face issues of privacy, obviously. Genomic information is often seen as different than other medical information and even other personal information. People have great concerns about violations of their privacy when it comes to hacking into their DNA. We face fears of genetic discrimination that many countries have addressed by legislation to prevent such discrimination. We actually have not found much evidence of such discrimination in Canada, but we still need to be vigilant about this possibility. And we overall face I wouldn't say concern, but the possible implications, I'm looking for a neutral term, implications of these profound changes to the way we deliver medical care. We don't know what it's going to look like when you have a chip containing your entire DNA that you could just present every time you go to the ER, every time you go to your doctor. What does that mean? Again, in terms of the quality of your care, your privacy, this information ending up in the wrong hands. We have concerns about genetic information in biobanks being shared with commercial entities, being shared across national borders. These are all relatively novel issues that emerged with these discoveries. And I think the best way to address them is obviously GEL's research to identify, analyze, and see how best to address, but by good governance. So regulations that are proportionate, that don't create regulations that are proportionate, that wouldn't create excessive burden on researchers or clinical use, but protect us as citizens at the same time. Where is that sweet spot? Where is this proportionate limitation? That is one of the key questions that we face as researchers so that we can recommend to policymakers the right type of governance to allow us to deliver all these benefits while remaining responsible and cautious.
If you had 30 seconds to pitch someone in a position of power in Canada to position us as leaders in biomanufacturing and bioengineering, who would you pitch and what would you urge him or her to do in 30 seconds?
I would pitch a minister, a federal minister, health or industry, and I would use my 30 seconds to talk about the importance of research, from basic research all the way to gels. I think we're focusing so much on the end of the pipeline. Give us research projects that can deliver in 3 years, in 5 years. Show us the economic impact of your research. Show us the social benefits that I can see from here, from where I'm standing. It doesn't always work like that. So I would use my time to pitch the importance of basic, fundamental research that often delivers surprises and delivers the most powerful tools economically without us knowing. And I would pitch, of course, the importance of funding GEL's research, because the best research outcomes in terms of science will not serve us Canadian citizens without the right ethical principles and the right governance. So I think basic research, GEL's research are where we have to keep funding flowing in order to deliver on the promise of genomics.